We check in with one of the best, professor of surgery at Washington University Medical Center, Dr. Bradley Freeman. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw. Good morning, Kelly.
Morning.
Talk about this new genetic test for women with breast cancer. This seems pretty interesting.
Yes, this is an interesting story, and it's a study that received, I think appropriately so, a lot of attention in the press. And so as we're all aware, in the last several decades, there's been a tremendous amount of research done in trying to unravel the human genome, that is, the genes that make us what we are in terms of personality and physical characteristics and that sort of thing. And the question becomes is how can you practically use that information? And certainly there's increasing information that it can be used to, say, detect susceptibility to diseases such as cancer or cardiovascular disease. And another way people have had a lot of interest in using it is, can you determine if a patient is appropriate for a given type of therapy? And so that really lays the background for this study. So this is a very large study in women with breast cancer, a specific type of breast cancer, that is early stage breast cancer, and breast cancer which had not, say, spread to lymph nodes or faraway organs. And this is a common type of disease that affects 100,000 women in the United States annually. And so what they did was they took a sample of the breast cancer tumor and subjected it to this genetic test, and on the basis of that, they determined whether these women would need to have, say, very aggressive chemotherapy. And the results were so striking that they halted one part of the study early to report it, and they found that if the genetic test said you had a very low risk of this being an aggressive cancer, meaning a cancer that had a likelihood of spreading, that you could forego chemotherapy and have a 99% chance of cure at 5 years. And so that's pretty striking, and what it does is allow clinicians to more appropriately, say, target these very aggressive and sometimes toxic drugs to patients that actually benefit them. So I think this is an exciting breakthrough and really confirms a lot of what people have thought about the use of genetic tests along the way, and I think we're going to see more and more of this in different applications.
Really interesting. All right,
yeah,
Doctor.
I think this is a real groundbreaking study.
Now let's talk about this other story. They've transplanted hearts and lungs and all sorts of things. Now they're transplanting uteruses?
Transplanting wombs or uteruses. And so this is a study, or this is a story out of Europe, specifically in the United Kingdom, and there has been a lot of interest, particularly in Sweden, at transplanting uterus or wombs in women who have either been, say, born without a uterus or have a congenital absence of a uterus, or have had to have a hysterectomy or the uterus removed at an early age for some indication, and obviously those women had been infertile. So they had a series of women who they successfully transplanted a uterus from a related family member and were able to show that it could successfully be fertilized and bring a fetus to successful gestation. So this is now being tried in other countries, and specifically the UK or England has reported that they are going to start a trial in 2018 in which they actually will probably transplant uteruses derived from people who, say, had died in, say, a car accident or something like that, meaning a cadaveric source, much as is used to get other organs, transplant them into women, and they would be fertilized with in vitro fertilization, and they would bring the baby to appropriate gestation, and then it would be delivered, and they say after 2 pregnancies they would remove the uterus because it would prevent the patient from being exposed to a lot of the medications needed to maintain these. So I'm not sure that this would apply to a lot of patients. It's not a very common cause of infertility, but it is a pretty innovative and striking development.
So you would have a father, you'd have a birth mother, and you'd have a womb mother.
Well, yes, in essence, you would have the womb mother, but in essence, genetically, genetically, presumably, the baby would be derived from the father and mother, and the womb mother per se would kind of just be the incubator.
Gotcha. Wow. Welcome.
Yeah, pretty interesting.
Welcome to science fiction. Dr. Bradley Freeman, professor of surgery at Washington University. Thanks for blowing our minds once again, Doctor. Have a good week.
Have a great week.
824, Big 550, KTRS.